Welcome to our comprehensive guide on medical emergencies in dental practice. Dental professionals must be prepared to handle a wide range of urgent situations, from fainting spells to severe allergic reactions. In this video, we'll break down the most common emergencies, their clinical features, and step-by-step management protocols. Whether you're a student, a practicing dentist, or a dental assistant, understanding these protocols can make a critical difference in patient outcomes. Let's begin by exploring the most frequently encountered emergency, vasovagal syncope. Vasovagal syncope is the sudden, temporary loss of consciousness, often triggered by anxiety, fear, or pain during dental procedures. It's the most common emergency in dental settings. Patients may experience lightheadedness, dizziness, pallor, nausea, sweating, and fainting. The underlying mechanism involves a vagus nerve reflex that slows the heart rate and dilates blood vessels, reducing blood flow to the brain. Recognizing these early warning signs is crucial for timely intervention and patient safety. When vasovagal syncope occurs, act quickly. Place the patient in a supine position with legs slightly elevated to improve blood flow to the brain. Use aromatic ammonia as a respiratory stimulant if needed. Always assess the airway, monitor vital signs, and provide supplemental oxygen if available. Prevention is equally important. Reduce stress through good communication and reassurance. These simple steps can help prevent escalation and ensure a safe recovery. Hyperventilation is another anxiety-driven emergency where the patient breathes rapidly and deeply, leading to excessive loss of carbon dioxide. This can cause lightheadedness, tingling, muscle twitching, and even carpal tetany. Unlike other emergencies, oxygen therapy is not indicated here. Instead, calm the patient, encourage slow, normal breathing, and avoid paper bag rebreathing. In severe cases, sedation with diazepam or midazolam may be necessary. Asthma attacks or bronchospasm can be triggered by anxiety, dental materials, or certain medications. Patients may present with coughing, wheezing, and difficulty breathing. Immediate management includes seating the patient upright, administering oxygen, and using a salbutamol inhaler. If symptoms persist, intravenous medications or intramuscular epinephrine may be required. Always monitor oxygen saturation and be prepared for escalation if the attack is severe. Allergic reactions in dental practice can range from mild skin symptoms to life-threatening anaphylaxis. Common triggers include antibiotics, local anesthetics, and latex. Mild reactions present with itching, rash, or rhinitis, while severe cases involve airway compromise and cardiovascular collapse. Immediate recognition and intervention are vital to prevent fatal outcomes. For mild allergic reactions, administer antihistamines like phenyramine maleate. For anaphylaxis, give intramuscular epinephrine immediately, followed by supportive measures such as IV fluids and corticosteroids. If airway obstruction occurs, be prepared for advanced airway management, including cricothyrotomy. Quick, decisive action can save lives in these critical moments. Diabetic emergencies are not uncommon in dental practice. Hypoglycemia, often due to missed meals, presents with confusion, sweating, and possible loss of consciousness. Hyperglycemia develops more slowly and rarely causes acute loss of consciousness in the clinic. Recognizing the difference is crucial for appropriate management. For conscious hypoglycemic patients, provide a sugar source immediately. If unconscious, administer intravenous dextrose or intramuscular glucagon. Hypoglycemic patients require supportive care and urgent transfer to a hospital. Always monitor vital signs and be prepared for rapid changes in patient status. Chest pain during dental treatment may indicate angina or even a heart attack. Angina is brief and resolves with rest or nitroglycerin, while myocardial infarction is more severe and persistent. Symptoms include chest heaviness, shortness of breath, and pain radiating to the arm or jaw. Immediate recognition and action are essential. For angina, administer oxygen and nitroglycerin, but avoid in hypotensive patients. If myocardial infarction is suspected, provide oxygen, have the patient chew aspirin, and arrange urgent transfer to a cardiologist. If cardiac arrest occurs, initiate CPR and use an AED if available. Every second counts in these emergencies. Seizures can occur due to epilepsy, hypoglycemia, or medication overdose. They are characterized by sudden loss of consciousness, muscle contractions, and sometimes tongue biting. Never restrain the patient or insert objects into their mouth during a seizure. Instead, protect the airway and monitor vital signs. Overdose of local anesthetics, opioids, or benzodiazepines can lead to serious complications. Symptoms may include agitation, confusion, respiratory depression, or even cardiac arrest. Management focuses on maintaining airway and circulation, administering oxygen, and using specific antidotes like naloxone for opioids or flumazenil for benzodiazepines. Close monitoring is essential due to the risk of resedation. Accidental aspiration or swallowing of dental instruments or materials can quickly become life-threatening. Most swallowed objects pass safely, but airway obstruction requires immediate action. Use Magill's forceps, suction, or encourage coughing for oropharyngeal retrieval. For severe obstruction, perform the Heimlich maneuver or, in infants, back slaps and chest thrusts. Surgical airway access may be needed if these fail. Blood pressure emergencies can occur during dental treatment. Hypotension often results from pain or anxiety and usually resolves with rest. Hypertension, especially with neurological symptoms, is a red flag. Management may involve medications like atropine or esmolol, but always avoid rapid blood pressure drops, especially if stroke is suspected. Monitor closely and refer as needed. Strokes and TIAs are critical emergencies, especially in elderly patients with risk factors like hypertension or diabetes. TIAs resolve within 24 hours, but are warning signs for future strokes. Symptoms include slurred speech, weakness, and loss of balance. Immediate recognition, supportive care, and urgent hospital transfer are essential for optimal outcomes. In summary, dental professionals must be vigilant and prepared for a variety of medical emergencies. Early recognition, prompt intervention, and adherence to clinical protocols can save lives. Regular training and emergency drills are recommended to keep skills sharp. Thank you for joining us. Stay prepared, stay safe, and provide the best care for your patients.